Namaskaram. This is Dr. S. Bharat Narendra from Live Right Clinic, Gindi. We have been creating content for Ayurveda doctors where specialists from the field of Ayurveda and other fields have been coming and sharing their gyan with us. Today we have Dr. Uday Kumar, a well-known pediatrician who is an Ayurvedic pediatrician. He will be sharing his knowledge about himself and about his practice with us. Hi, Dr. Uday Kumar.
Hello,
Good
sir.
morning.
Hello, Dr. Bharat.
Good morning.
Good morning.
So, I have known you since decades. We have studied together. You have
Yes.
we have been in the same college. But for the viewers who are viewing this podcast today, can you please give us an introduction about yourself from the personal point of view? Where you are from? How did you get interest in Ayurveda? What made you study Ayurveda?
Okay. This is Dr. Uday Kumar, native of Tirupati, Andhra Pradesh. Okay. I graduated from the same college where I'm working right now, Sri Jayendra Saraswati Ayurveda College and Hospital, Nazratpet, Chennai. And I was of this third batch, 1997, and I passed out in 2003 and got enrolled myself for masters in Ayurveda from Rajiv Gandhi University of Health Sciences, Bangalore. And then since then, I was working at Amrita School of Ayurveda, Kerala. And from 2008 onwards, I'm working at my mother institute, Sri Jayendra Saraswati Ayurveda College and Hospital. Presently, I am a professor and head of the Department of Kaumaravatya, that is Ayurveda Pediatrics, at Sri Jayendra Saraswati Ayurveda College and Hospital. I practice at Ayappantangal in my evening hours between 6:30 to 8:30, and I do visit Live Right Gindi Clinic on every Saturday in the evenings. So, and regarding my interest towards Ayurveda, I'm not navy to Ayurveda. Since my childhood, I have been exposed to a lot of Ayurvedic interventions or medications. Um, and we have our own family doctor who was principal of Tirupati Ayurveda College, and he was one of my gurus who has who guided me to pursue Ayurveda career.
Wonderful.
And so before starting my Ayurvedic graduation itself, I know few of the medications.
Okay.
So usually before consulting the doctor, like OTC, like how we usually do, like whenever we have fever at home, we used to have Amrutarishtam, Lakshmi Vilaswasam, all these medicines by ourselves. We treat ourselves, I mean, like, which is not so.
As
But again,
doctors, right now, we will not suggest that. That is
but,
right. That is right.
Before consulting the doctor, we used to have at least 1 to 2 doses of that medicine, and then if the fever doesn't subside, and then we used to consult.
That's right. That's right. Because these medicines, like how you said, Amrutarishtam or some other medicine that we might give, Sudarshanavati.
Yeah.
These medicines, as everyone knows, does not have any side effects, and we have been using this day in and day out.
Yeah.
And ethically and morally, I don't think there is any conflict when it comes to using it. So I don't think it's a problem. Right?
Okay.
That is one thing. So definitely, your family must also should have had some influence in your
Yes,
career.
definitely. My father used to make some medications on his own, some plant-based medications, which he got through the Parampariyam.
Wow.
For some oils he used to make, it has got some great wound healing properties, and we used to give it for all the conditions, and also for the diabetes. Okay, and that same combination I practice, I got inherited from him, and I practice it in my clinic too.
Okay.
So Ayurveda is not a navy or a navy to me. Okay?
It is not a kind of an alien thing to you.
Yeah,
You have always been a practitioner of Ayurveda in the sense that you have been taking medicines and later you have come into this. Good. So you were talking about a guru from the Tirupati College, yesterday your principal of Tirupati College. Can you name him? Is it
Dr.
okay to-
Rajaya, Dr. Rajaya. He was our Dr. Rajaya. He was our family physician,
Mhm.
and he introduced. He said about how is the Ayurvedic education and all, and what is the course, and what are the opportunities, and how to take the process of admission and all. Because at the time in 1990s, I am the first person in my family who started pursuing medicine.
Hmm.
Okay, so everyone was not aware of the process of medical admission and all. So he was the person who guided us. So we are always indebted
Thanks for that in-depth. It's
to
very nice. Doctor, in present day, I'm very sure our viewers will have this doubt. Not many people know that Ayurveda can treat pediatric cases, that is, can treat children. And very few of them, even who know that pediatrics is available in Ayurveda, very few of them will know that there is an MD course in pediatrics in Ayurveda, which you have done, and you are the HOD of the department also now. So, what are the challenges in your practice that you face when you treat pediatric cases? General challenges that you face.
Okay. So the first challenge, first and foremost challenge, should be like a lack of awareness among the parents. Okay. They consult, they come to hospital for a random thing for a general medicine, and then they see the branch of pediatrics, and then then they come to know that okay, there is a here they treat pediatric cases also. That is one major. So before walking into the clinic, so there is one major issue which we face, lack of awareness. And the second thing is, see, right now the pediatric practice is completely a different one. It's a tricky pediatric practice, we have to say. Every parent, almost every parent, around 80 to 90% of the parents, they visit pediatricians at least once in a month.
Hmm.
The reason might be
True. True.
lack of immunity, that is repeated infections,
Yeah.
cough and cold, could be fever, repeated fevers. Okay, like this is one of the most common thing. The second thing might be like food refusal.
Yeah.
Okay, whenever we say that we are a doctor, and if the patient seems to be a young parent, then automatically they will ask, doctor, can you name a syrup which can be given to my child so that the child will start eating. Okay, will increase the input. Okay, so if you see, my only question is the child consuming good amount of snacks, junk, all these things? If the child doesn't consume even snacks, junk, and all, then only our syrups or appetizers will work. If the child is consuming narkatini or all this junk foods or
savories
snacks
and
or
food,
all these
sweets,
things,
and yeah.
and when you take the food plate, the child starts refusing, food refusal, then the problem is with the mindset. So for mindset, there is no syrup.
Yeah.
You should make the child involved in cooking, so that you should make the eating should be like a, what to say, it should be interesting.
Understand.
Many of the parents, especially Indian mothers, are known for forceful feeding.
I know.
If the child doesn't eat in the morning, automatically they will try to compensate the morning diet along with the lunch, and they will say that morning you have not eaten, so afternoon you take. Child
So
cannot
you have
take that.
taken only half dose in the morning. So afternoon you will have one extra
Yeah.
meal.
So the child cannot take. Okay, so forceful feeding is one of the main reasons for making the for creating the aversion towards the food. So it should
So,
always be like a demand feed.
Can I say that the mindset of the parents
Yes.
have to change
Yes.
rather than the child?
Yes, yes.
When you cannot expect your child to eat like an
The
adult.
daily routine food cannot, but the child cannot eat. And we need to make different. One advice what I give to the parents is like, for example, if you're making chapati, puri, and all, make it as a small shapes, different shapes, star shape.
Yeah, we do.
So it will make the child interesting.
Interesting for the child to cook,
And
and at
also
the same time interesting for the child to eat.
eat.
Because it has been emotionally involved in that cooking.
Yes.
It is easier for the child to accept it.
Accept it.
Nice, nice. So,
Okay.
as we are progressing, I would like to tell our viewers, I would like a disclaimer per se. This podcast is for informational uses only. And whatever doctor or myself, when we suggest some practices, some home remedies or some medicines, it is best for you to practice it with an Ayurvedic doctor's prescription. It is always best to do that. So, Doctor, what are the common health problems that parents come for their children? For what they approach you generally? For what the viewers can understand, for
Yeah.
what they can approach you?
Okay.
Yeah.
One major concern for the parent is the parent thinks that the child should be chubby. Okay, the child or the baby should be round. Then only the baby is healthy. But that is not the fact.
Yeah.
Okay, weight is very, very important.
Yeah.
And a proper height. Okay,
Yeah.
so we need to see. It's not about the shape of the child or the shape of the baby. Okay, and the baby is looking very lean. Give some health tonics which will make look the child chubby. So that is not the way of practice. Okay, there is one issue. So I always ask them.
I am going to cut you here 1 second. When you're talking about a very rounded, well-rounded child, the pun intended. Okay, so don't you think some lifestyle changes also would have impacted this
Yes,
thing to
definitely.
happen? And I would like you to underscore that also when you
Yeah.
are talking about it. And what is the Ayurvedic perspective on these lifestyle changes?
Okay.
Yeah.
See, lifestyle changes. If you talk lifestyle changes, it has impacted the childhood a lot.
Yeah.
Okay. So the first and foremost thing is a lot of advertisements.
Mm.
Okay, the children are exposed to a lot of advertisements and this soft drinks.
Yes.
Okay, it has got loaded sugars.
Yep.
Okay, and it is one of the major reason for early onset of diabetes, or we can say that MODY diabetes, that is
Yeah.
maturity onset of diabetes in young.
Modi diabetes. Okay.
Okay, that is one thing. Okay, and the junk foods, burgers, all these things.
Yeah.
Okay, that is one thing. And all these drugs, all these medicines, what it does, I mean, like food, all these foods, what it does is it will impair the absorption of the micronutrient. If whatever the healthy foods the baby is taking. Okay.
So something like the concept of ama
Yes,
in Ayurveda. I mean,
yes.
I don't want to do too many technical jargon
Yeah.
here, but we can introduce one or two there so people can go and search for
Yeah,
what is ama.
yeah,
and all
yeah,
that.
yeah.
Is it kind of an ama?
Yes, all this loaded with cheese, loaded with all these things, too much of oily this one.
Yes.
Okay, and there's a concept like air fried foods. Okay, instead of oil fried, it is also called as air fried foods, and that is also one reason. All these things it alters your metabolism and also the absorption rate. So there is one common complaint. The second common complaint will be like constipation. Okay, parents will complain that the child is having constipation, but we need to see that especially the babies. Okay, as long as the baby is on exclusive mother's feed. Okay, passing stool, passing motion once in 15 days is normal, provided no abdominal discomfort and no problem in the feeding.
Once in
Then
15
days is also normal.
Oh.
But a baby passing 15 stools in a single day, okay, provided no signs of dehydration, no abdominal discomfort, nothing, provided the baby is active, that is also normal.
Oh.
So both these extremes are
Big
normal.
spectrum, huh?
Both these extremes are normal when the baby is on exclusive mother's feed.
Mm.
As soon as you start introducing the when you start you're starting this weaning, this combination will not be right. Okay.
So I'm going to cut you here again. So you have to give some perspective here. When should a parent approach us, or when should a parent approach you, for that matter of fact, in pediatrics? That is for the child, for a child who is only Kshirada, that is only taking the mother's feed. if the how will they know whether the child is constipated or not? This is a big spectrum, right? 15 days once passing motion, 15 times in a day passing. So when should they approach you for this?
See, once the baby starts refusing feed,
Okay.
okay, and if the tummy is bloated, okay, and if the baby is having difficulty in breathing, because automatically when the tummy is bloated, automatically
Puts pressure on the lungs.
the abdominal pressure will be raised, and
Ah.
automatically the baby will have difficulty in breathing.
Mhm.
Okay, so and the baby will feel screaming, or the baby will be irritable. Okay, so in that condition, automatically the baby, the baby should be brought to a pediatrician. Okay, and the baby is passing stool for 15 times and regularly, and if the stool is too watery, and if the signs of dehydration is there, and if the baby
What are the
is
signs of dehydration?
if the baby is becoming lethargic, drowsy, dull, not playing. Okay, the playing for the baby is only kicking movements,
Yeah.
kickboxing movements.
Yeah.
If the baby is silent, okay, then, and if the weight gain is not proper, is not regular, okay, then these are the signs of dehydration. So then we have to take the baby to the pediatrician.
So in that case, when a person wants to approach Ayurveda for their child, you'll be able to help them.
Definitely.
Wonderful, wonderful. This, I'm not asking this as a layman. Of course, I know this, but I want the viewers to understand that
Yes.
they can approach an Ayurvedic doctor for this.
For this.
This awareness is of utmost importance. And when I was asking about the common things that parents come to you for their children, one other thing is the performance in school and the memory issues.
Okay.
What Ayurveda has to offer for this?
See, school performance is based on many factors.
Yeah.
Okay.
Yes.
Some kids will be absent-minded professors. They'll be physically present and mentally absent.
Yeah.
They'll be engaged somewhere, mentally engaged in somewhere. That the main reason for that might be like too much of screen time. Video games, all these things, and
I am going to cut you here again. Have you not seen a good amount of this thing between a combination between the screen time and food? Many parents use
Yes.
screen time to feed their children.
yes. The reason is the child will not refuse whenever the mother is bringing the hand to the mouth.
Yeah.
Automatically, the baby will start opening the mouth like a hippopotamus.
Autopilot.
Okay, so but that is wrong, because usually we'll say that in the older days we'll say that whenever you are having food, concentrate on what you eat. So this concentration, it will stimulate the other process of gastric secretions. So if you start thinking on the food, and if you concentrate on the food, if you realize the taste of the food, okay, then automatically your gastric secretions will be doubled. Okay, but when the baby,
So there is scientific value for
yes,
this. Oh,
yes, there are
nice.
3 phases of gastric secretion. What we all might have studied. Okay, lingual phase, gastric phase, and intestinal phase. What we have already studied.
Right,
So
right.
this lingual phase is stimulated whenever the baby sees the food, smell of the food, taste of the food. So this lingual phase, that is lingual is oral. Okay,
Yeah.
this lingual phase of the gastric secretion is a base for the subsequent phases of gastric secretion, the gastric and intestinal. So when the baby's mind is somewhere on the video, then automatically this lingual phase will be absent.
Just lost, yeah.
And the other phases will be affected. Okay, so it is like the
It is
quantity
like
of
starting a car from the third gear or the second gear instead of the first.
gear, and the quantity of the food is not the actual matter. It is a quality of the digestion.
I know.
Okay.
We don't know whether the children are properly chewing it also, right?
Yes, yes.
When they have the screen time. Good. So this is what we used to say, that concentrate on your food and have.
Yes.
So there is a challenge here when you say that the child has to concentrate on the food and have. 2 things I'm going to ask you. One is what we do when we try to introduce new foods that they don't like. How do we approach this? Number 1, how do we approach with a new food that the child does not like? Number 2, that is new tastes, right? And when you introduce new food and it doesn't work, it doesn't agree with their stomach, it doesn't agree with their gut, how do we approach that? Is there any procedure that we can follow?
Yes. See, introduction of new food should be done very carefully. Okay, and we have to approach in two ways. One is through the palatable issues. Okay, how to make the child have it without disturbing its taste perception. The second one is how to make the baby adjust, that is the baby's body adjust to the new food. Okay. The taste, what I usually regarding the taste, what I usually advise my patients is, whenever you are giving any vegetables, boil it, add some cooked dal, put it in mixie, make it as a paste, and mix it in dosa batter, idli batter.
Wonderful.
Okay, and give it. Okay, then automatically the baby starts
And they get color dosas.
color. Yeah, okay. So the baby starts eating that.
Yeah.
Okay. And the second one is coming to the how we have to introduce new foods for the baby. See, new foods should be introduced one single food at a time. Use it for 1 week. For example, if you are introducing brinjal for the baby, okay, give brinjal.
You're talking
daily
about
once.
what age of the baby?
Right from 1 year onwards, we can give family pot. Right,
Okay.
from 1 year of age, we can give family pot diet. Okay.
Good. So you will start one thing and continue it for 1 week.
1 week, and then see whether the baby is how the baby is responding. Okay, and if the baby is responding normally, if the baby is normal, then you can introduce another. Okay, so don't make it as a khichdi and introduce all the vegetables
I know.
or all the food at same time. We don't know for which the baby starts responding in a negative way.
Yeah. So
Okay.
there are some views that when you give a new food and the child doesn't agree with it, the gut doesn't agree, maybe it can have loose motion or bloating. If it is a good sattvic food, homemade food, and still the child is not able to digest it properly or something, then there is a notion for some doctors do advise that you continue the same food for 3-4 days. After the third or fourth day, when it gets settled down, it is okay.
Yeah.
Is that fine?
Yes, that is also fine. Okay, there is one condition in neonatal conditions we call it as a breast milk jaundice. Okay, jaundice, usually the physiological jaundice everyone might be knowing.
Yeah.
From the third day, fourth day it starts. There is one condition called as breast milk jaundice. Because of the breast milk feeding, okay, jaundice will be seen. So in that condition, the recommendation is keep on feeding.
Continue the feed. Yeah.
Okay, so the body, some babies they take more time to get adjusted. Okay, and it's always like we need to see the effects of introducing the new food. Okay, what are the effects? If the effects are minimal, continue it. If the effects are too severe, consult a physician and then take the advice and then decide whether to continue it for 4 days, 5 days,
Good.
and see whether the baby is
Good.
responding to it or not. It is not that always we have to continue it, only on the advice of the physician.
We can take the physician's advice. That is
Advice.
very right. And there is also another part from the parents. They try to. We have 6 tastes. In Tamil, we say arusuvai undi.
Ama.
All 6 tastes, right? And the mari vandu when the parents sometimes want to introduce too many new tastes to the children. For example, in my house, my younger one is around 5 years old now, and some people in home want, when I say some people, I'm terrified about whom. Okay, so some people want to introduce pungent to the child. Is that right to introduce at this age, or we should allow them? Is there some space that we can give to the child and ask them to take the pungent and other things, maybe a little bit slower?
Yes, that can be done. Okay, that can be done. But again, whatever said, make the child have small, get the child exposed to all the tastes. At least-
At which age can we start all tastes?
See, palatability matters.
Hmm.
Okay, in the practice, what we see right now is from 7th month onwards, we'll start giving all the foods. Okay,
Yeah.
I'm not talking about the non-vegetarian diet.
Yeah.
I'm talking about the only vegetarian. family
Vegetarian
food.
diet.
Okay, so from 6th month, 7th month onwards, once the baby starts, what is a small, like when the teeth starts erupting automatically, after Annaprashanam, we'll start mash it
Yes.
and then give.
Yes.
So at that age, whatever food you give, the baby will start taking it. The baby will not have will not be able to appreciate the taste at all.
Yeah.
But once the baby starts walking, running, then the difficulty for the parents starts. So that is the age where when before that, if you start introducing all these tastes, then it will be very easy for the child to get acclimatized in the later part of the
Oh.
age. And but whatever said, the child has got some rights.
Yeah, that's
Okay,
right.
there is, we'll call it as right to education, right
Yeah.
to like that.
Yeah.
The child's right is eating chocolates, eating all this.
Oh.
Okay, but as a pediatrician,
I
or
should
as
be
a doc-
I should be very careful. My child does not watch this video.
as a doctor, one advice is stop eating chocolates.
Yeah.
Okay, but that is not the way of. We cannot upbring a child
uh,
by keeping away from chocolates.
okay.
Okay, it is their birthright to
It's a
have.
birthright. Yeah.
To have.
We have had. I mean,
Yeah.
let's be frank. We in our childhood we have had our fair bit of ice
So
creams.
what I advise them is
uh,
give whenever the child is very adamant of chocolates or something like that, cakes, pastries, this what is it, Kinder Joy, all these things. So after taking that one, give a cup of warm water.
mm,
So what it does is it will remove that what is the sweet which is got accumulated in the pharynx. Okay. Then automatically the child will not have much of this respiratory.
oh,
This
okay. Good.
Okay.
Good advice.
But usually, what the thing is, they will have this chocolates, cakes, and all, and the next 2 days they will have
Cough, cold. Yeah.
This can be minimized by
With the hot water.
With this hot water.
Is there something we can fortify the water with, like some people use jeeragam taddi,
Yes, yes.
like that? Is there something that you
Yes,
can use for the children?
I advise them is what I advise is 2 to 3 liters of water, half teaspoon of dhania,
Dhania.
half teaspoon of jeeragam,
Mm.
and a half inch of ginger.
Okay.
It could be wet or dry ginger. Just boil it for 10 minutes. That water can be consumed whole family.
The
This-
child can also have.
Even child can also have. So this will improve the absorption. Okay, now this will improve the appetite,
Mm.
and it will the ama what we are talking in the previous. I mean, sometime back.
Yeah.
Okay, that will be resolved.
Okay.
Okay, it's a simple home remedy which can be practiced by everyone.
Wonderful. So you're saying that even from the age of 7 months to around 1 year, when the child is trying to walk, just before that,
Yeah.
it is better to start all the 6 tastes.
Yes,
But
yes.
in ration,
In
right? You
a
have to
ration.
ration it and
Yes.
use it even bitter taste, astringent taste, and pungent taste. I've not done this. I'm seriously. This is new to me. Being a doctor, this is quite new to me. My child has one problem. What she does is she eats only sweet. The other tastes, we have to a little bit, we have to struggle with her. So, have we done the mistake of not introducing enough tastes at the right time?
Yes, yes, that is the one thing. That is when the children or in a younger age, if they get accustomed to all these things, then it will be very easy for them to acclimatize.
There is a new theory coming up in allergy
Yes.
side. You see, some years before, maybe 7, 8, 10 years before, allergy specialists used to say, if the child is getting allergy for something, then don't expose the child to that. This was the view before. Nowadays, they are even in the US and here and all over the world, for the matter of fact, doctors ask parents to ration all the food items that the child will start having even in the future. For example, like peanuts and other things, nuts allergy, cinnamon allergy. Start these things in small quantities, expose the child to that, let them start getting the immunity to this. So, will you also advise the same thing?
Yes, I perfectly I accept this one. See, in the olden days and all, before the advent of this home cleaners, floor cleaners, all these things, okay, the child used to play all over the
Yeah.
and the child walks, crawls, goes to the corners, and with the same hand the child keeps it in the mouth. So the dust or the dander or whatever that the child ingests at a very young age, and the immune system gets triggered. The immune system which is there in the young age, it will be there lifelong. Right? So they mop the floor with floor cleaners, and we grow the child in a complete sterile environment. And once the child, after 1 year or 2 years,
Yeah.
the child gets exposed to this external
Yes.
allergens, the child starts all these things.
Mm.
Okay, so early introduction is one main mistake. I mean, like we have to do it, which we are not doing right now.
So we are not saying don't keep your houses clean, but we are saying that expose the child
Yes,
to more.
the normal. How
Take the
we
child
are,
out.
Yeah, how we are exposed. Okay,
Ah.
to the normal routine. When you're going to the on the road, we don't cover. Majority
Yeah.
of the people we don't cover our
Yes,
except in the
we-
COVID period.
Yeah.
Okay, so you make the child get exposed
From what age can we take the child outside the house once it's born?
after 1 month.
After 1 month. First 1 month, it is better to be very sterile and keep the child this thing. And after that, starting
Yeah.
with all
And,
this pollution
yes,
and all this
yes,
thing.
yes.
It's okay.
And also, it is also dependent on uh, uh, the the feed what the baby is taking.
Hmm.
The baby is on mother's feed,
Hmm.
the immune system is very strong.
Pretty good. Yeah.
And if the baby is on
Yeah. Formula
formula feeds,
other.
then automatically there is no other way of like we have to grow up the baby in a protective environment.
I can understand. I can understand. So we started from common challenges in school, that is memory and cognitive this thing problems, and we migrated somewhere else. So I would like to bring you there again. So what are the challenges that parents face with their children, that is performance in school and their cognitive abilities?
Okay.
How Ayurveda can help there?
Okay. Vallari,
Yes.
Vallari, Brahmi, okay, and Saraswati leaf, okay, that is very good for improving the immune system, okay, and also the memory, okay. And second thing is pure cow's ghee,
Mm.
okay, that is very good for improving the memory or the intellect of a child, okay. But the concept of parenting or even our eating habits is we don't have ghee or we don't oil is less at house, but when you go out we'll have one tub of popcorn which is made out of other okay,
I can
and fried
definitely
chicken or something
deep
like that.
fried ones also.
Okay, so when you go out our diet pattern is completely changed, but when we are inside when you are at home our we are more of health conscious. This is quite contrasting. So at home you use more of good quality ghee, that is without adulterated one, okay. Good quality of ghee and good amount of oils. I always advise like to take to have a mixture of oils,
Yeah.
coconut oil, gingerly oil, sunflower oil, and small amount of even palm oil also.
What about groundnut oil?
Groundnut oil, all the oils. It should be in a rationed amount. Use all the oils. Okay, and
Not mixed together.
Not,
for each thing one.
for
Yeah.
each.
I can
Okay,
understand.
and usually off late this olive oil has become
Very.
Okay.
It's a rave now. Yeah.
oil is used only for garnishing.
Yeah.
Okay, that should be the method of this one. And another thing what I advise is this pumpkin seeds. Okay, roasted pumpkin seeds. It can be powdered and it can be mixed with dosa maavu or whatever with it, or even sattu maavu kanchi, what we make. Okay, that can be given because this roasted pumpkin seeds contain zinc.
Wow.
Okay, and
Micronutrients,
that is very good for improving the zinc and also magnesium. So the magnesium, it will stimulate the serotonin and all this melatonin, this one, and it improves the memory also.
Wonderful.
Okay, so pumpkin seeds. I usually advise like pumpkin seeds, watermelon seeds, flax seeds, okay, sunflower seeds. Okay, all this take dry roast, make it as a powder, and you can mix it with sattu maavu kanchi or dosa maavu or whatever with it. So this is a very good source of protein.
Amazing product idea. I'll look at.
This can be tried up.
Definitely. So, when you were talking about cognitive skills and memory, you mentioned two drugs. One is Vallari Brahmi and the other one was Saraswati leaves. Most of the parents, but they don't have time to bring up their children, and it's a challenge for them to to bring their children up because most of the times both are working. So, most of the times parents ask me this question when they bring their child: is this home remedy available as a ready-made medicine, as a classical one? We don't have to go into patents right now. As a classical one, is anything available?
Yes, Saraswatarishtam is available.
Wonderful.
Saraswatarishtam with gold. Okay. So even gold is mixed in that.
Hmm.
Okay, Saraswatarishtam.
So when we say gold, it is gold's bhasma. It is the oxide of
Oxide
the
of-
gold. It is no more a metal.
Yes.
It is not going to hurt
It's
the child's.
completely safe.
Yeah, very safe. It's not going to hurt the child's liver or kidney.
Yes.
There have been many studies conducted on this. I've been repeating this in all this thing. So I think our viewers are quite with this thing with that. Yeah. So Saraswatarishtam with
That is
gold.
With gold. That itself is a single damn shot drug for improving the school performance, for making the mind active, all these things.
What about Brahmi?
Brahmi is also given. Brahmi Vati is available. Okay, Brahmi Kalpa is available.
Brahmi Vati is available in gold also, with gold also, without gold also. Usually, I think Brahmi Vati with gold is used more in senile problems and neurological problems and all that. So, ordinary Brahmi Vati is enough. Enough. It's palatable also.
Yes.
You can mix
It's a
it with
small
anything.
tablet.
Yeah.
You can once a child is able to swallow, a small tablet can be taken. Okay, if the baby is not able to swallow, powder it, mix it with cow ghee and honey, and give it. Okay.
Brahmi is available in Gridam form also.
Yeah,
Right?
Brahmi
It's not
Gridam
very
is also-
palatable, but available.
In that conditions, what we can do is for the dosa, that Brahmi Gridam can be made as a small.
Amazing idea. Amazing idea.
Brahmi Gridam can be used and given.
Great idea.
Okay.
Yes. So this is one thing. Children nowadays, not only elders, children nowadays also have a lot of anxiety and stress disorders.
The main reason
has
is-
Ayurveda does Ayurveda help there?
And the main reason for that is screen time.
Screen time.
Okay. And now, see, video games. There are many video games which will improve the memory power. Okay, which will improve the brain or which will make the brain more active. But there are many video games which are destructive, which ignites the negative conscious of the there are many video games which are
Right.
killing, which are
Right.
kickboxing, all these things. It will make the child more aggressive. So this aggressive behavior automatically it will create anxiety. So if at all if the baby wants to play the video games, ration it, select the video games, and
So parents play the video game first, then
Yes.
give it to the child. Okay.
okay.
So what
And
Ayurveda gives?
yoga,
Yeah.
meditation.
I was about to ask, what are the lifestyle
Yeah.
managements and what is there any medicine that you have to go for this?
And one more thing is, we cannot always instruct the children. The parents has to do it, has to show it, and then ask the children to follow it. But how many parents are doing it? How many parents are practicing yoga and making the child aware of it?
I
That is
know.
also one major
I know.
thing. Okay, so pediatric practice is not just about treating a child. It is more of counseling the parents and treating the child.
So, doctor, we'll go to another problem now. Another very common problem that parents bring their children for is respiratory issues, asthma, continuous cold, cough, fever, and all that. So, sometimes even with fever, without fever. So, what kind of respiratory disorders can Ayurveda help? For what respiratory disorders can parents approach Ayurveda doctors like us?
See, common respiratory illnesses. Okay, could be common respiratory illnesses, recurrent bronchitis, chronic bronchitis, upper respiratory infections, lower respiratory infections. Okay, in these conditions, common cold, flu. Okay, a flu, many people think that treated cold lasts for 1 week, untreated cold lasts for 7 days. But
now flu is very rampant in
Yes.
Chennai, right? I even read an article about that.
Yes,
Yesterday, I wrote an article about
okay,
that.
many viral, in all these viral respiratory infections, Ayurveda does wonder. But again, we should know our purview of treatments, treatment modalities available, our limitations, and then we can step into it.
Wonderful.
Okay.
Wonderful. So even for asthma and things like that, Ayurveda is
Yes,
quite
definitely,
helpful.
definitely.
So
We can see most of the children whom I am consulting, who are asthmatic patients, they were on long-term
corticosteroids.
conservative and the what to say, the contemporary system of medicine. It
yeah.
could be any system, and they will be on steroids. They'll be on many
Yeah.
conditions. So we cannot withdraw those steroids at
Yeah.
once.
In Tamil, we say pulivalu. You
Yeah.
cannot leave it immediately.
Yeah.
Sometimes you have to
It should
slowly
be
wean
slowly
it.
tapered.
Yeah.
And then
Tapering.
only we can introduce or we can increase our dose and slowly we can wean off. Okay.
That is really nice. That is really nice. So when I said respiratory disorders, one important component in this is immunity. What the children? Most of the parents are worried about the child's immunity. Sometimes they become overprotective, like you said. They clean the house 2-3 times. They actually expose the child to more chemicals
Yes.
by trying to keep it very clean. But they should rather expose the child to mud and other
Yes.
this thing, right? My question is, what Ayurveda has to improve immunity? What Ayurveda has to give in a daily basis? What we can give to the children to improve immunity? And second one is when you are. I also want some home remedy for that and some medicines for that. Anything.
See, when you talk about improving the immunity, it could be the best one is Swarna Prashana. Okay, Swarna Prashana
Son.
is very good, and we are doing right now here, and it is done on Pusa Nakshatram, Pushyami Nakshatram. The reason why we have selected that Pushya Nakshatram is, see, every living organism, every living creature is in sync with the nature. The only living creature who is not sync with the nature is human.
Mm.
Our day starts at night, ends in the midnight, all these things.
Yeah.
Okay, we have to accept the fact that our system is governed by the extraterrestrial influences, the influences of the stars, influences of the
It's definitely
nature,
there.
all
Yeah,
these things.
yeah.
So this Pusha Nakshatram or Pusa Nakshatram, on this star, what will happen is our immune system will be, or whatever the good thing what we do, it will have its maximum potency. Okay, so that's why this star Pushyami, or which increases Pushti, okay, or which gives maximum nourishment. Okay, on that day we usually give this Swarna Prashanam. So Swarna Prashanam is given right from day 1 of life till 16 years of life.
Ah, very good.
Okay, there is one very good medicine which can be given by an Ayurvedic physician for a child. Okay, and your parent will realize its effect even by simple 3 months to continuous usage of this medicine for 3 to 6 months. The immunity will be improved. Okay, and to improve the immunity, many like again, diet plays a very major role. Okay, the fruits and vegetables which are in dark color has got a good amount of vitamin A. Okay, and this vitamin A is very important for improving the immunity. Okay, vitamin A is also important in preventing respiratory infections.
Wow.
Zinc is very important in maintaining the ciliary epithelium of the respiratory tract and also the urinary tract. So this zinc, vitamin A is seen in all this dark colored vegetables. For example, red bell pepper, what we use in the pizza and all. Okay, red bell pepper, green bell pepper, yellow bell pepper. Okay, all this contains good amount of retinols.
So that is the kodamalagai we are talking about?
Yes. Okay, capsicum.
Capsicum.
Okay, and vitamin A, whenever a child comes with some respiratory infection, always keep in mind presence of zinc deficiency and also vitamin A. Okay, whenever we give medicines which will remove the thabam in the chest, the phlegm in the chest congestion, one of the main consequences of respiratory infection. Okay, don't just think of removing the chest congestion, improving the vitamin A. So once the vitamin A is improved, automatically the baby's immune system will be improved. Okay.
One more thing that many people approach us nowadays is for attention deficit and hyperactivity disorder, ADHD. There are so many children who are affected by this. There are many societies which are formed for this. those children are, they don't act. I feel that they don't reach their own potential, although they can do a lot more. How can Ayurveda help in ADHD?
ADHD and autism it comes under ASD spectrum. Okay,
Yeah,
autism
ASD.
spectrum does autism. Okay, ADHD, that's hyperactivity is one major. This one, many of the parents they think that hyperactivity is very common in children. Okay, குழந்தைனாக்கா துருதுருன்னு தான் இருக்கும். Okay, but turuturu or not being naughty or active is different, but being hyperactive is completely different.
Yeah.
Okay, so early identification plays a major role in the prognosis of the condition. Okay.
How can a parent know that fine line between normal turuturu, what we call that kind of a good activity, naughty character activity, and a hyperactive child? How a parent can differentiate?
Hyperactive child will be more destructive in nature. Okay, more destructive in the sense they will not sit in one place. Okay, the naughtiness will come only normally in a child. The naughtiness will come only when the child becomes comfortable with the environment, with the people.
Yes, exactly.
Okay, but in hyperactivity, naughtiness will be there even in alien conditions, atmospheres, alien people also. Okay, so this one factor is enough to identify whether the child is naughty or hyperactive.
Amazing. So this is then what about attention deficit, doctor?
See, attention deficit again, we have very good medicines for improving the attention capacity and also reducing the hyperactivity. For reducing the hyperactivity, simple technique what I usually tell them is like take any oil. It could be coconut oil or nallanai. You add a pinch of camphor, make it as warm, and then apply over apply over the body. Do good oil massage. That will reduce the hyperactivity.
Amazing. Yes, okay, I tell my children.
This is one thing. And coming to the attention deficit, the training is very, very important. Attention deficit, again, the child is exposed to screen time more. Okay, so the children who are born just before COVID and whose the primary school age is during the COVID period, they are more having they are facing these problems in a more aggressive way when compared to the other children. So screen time is one major thing which we have to cut down.
Okay, we have to cut down on screen time. And so we talked about ADHD, we talked even about autism, and one common question that parents ask when they come with any kind of spectrum disorder is in how many days, weeks, months or years will I start seeing good results in my child? I know I'm not, as a doctor, I'm not supposed to ask this question, but as a layman, for others, we have to give them some perspective. We have to give them some context of how long you'll have to
see in ASD. See, in ASD, it's like it's a functional disorder.
Yeah.
Okay, it's a functional disorder pertaining to the brain development, neural migrational disorder. Okay, so it is not a condition just like a malaria, dengue, or something like that, wherein take this course of medications and you'll be fine after this.
Yeah.
So this condition, it needs a prolonged treatment. As a physician who has seen some hundreds of cases of ASD, I can say that in a matter of hardly 1 month, you'll start seeing the results.
Good.
In improving the eye contact, in reducing the hyperactivity,
sitting
tolerance, in following the commands, understanding abilities, improving the peer relationship. Wonderful. All these things in a matter of 1 month. Again, this treatment of ASD, it's not like a physician alone cannot do.
Yeah.
We need the help of behavioral therapists, OT, speech therapy, all these things. Parents. And the captain of the ship is parent. And we are all auxiliary part.
Exactly.
Okay. So within 1 month, they can start.
You can start seeing results. Definitely good results. So there are also other developmental delays that some children face. Is there a place in Ayurveda for these children who face developmental delays?
Yes.
Global developmental delays?
Yes, definitely. Again, early intervention. The cause for GDD, that is global development delay, is it a genetic cause or is it due to the prenatal causes? We need to see, is it due to the birth asphyxia? There are many conditions which can cause GDD. Depending upon the cause, better treatments can be developed for the child. If it is of a genetic causes, syndrome, all these things,
Yeah.
then the prognosis is very less. I forgot to this one. Gut health.
Yeah.
Gut health plays a major role in the treatment of immunity, in improving the immunity, and also in improving the prognosis of ASD.
Wow.
Okay.
So you're talking something like about the gut
Yeah.
being a second brain or
Yeah,
something. Yeah.
Okay. So the first question what I ask is, how is the gut health? Okay. The parent will not be knowing what is gut health. Then I will ask, what is the smell of the stool? If it is too smelly, then the gut health is abnormal. Give medicines which will improve the gut health. Once the gut health is improved, you will see around 20 to 30% of the reduction in the symptoms. And I advise them not to have this casein and gluten diet, GSFC diet.
Yeah.
Okay, casein free and
Gluten free and casein free foods.
diet.
So any specific medicine that they can use for this gut health on a regular basis?
I usually give Gandravastadi Kashayam.
Ah,
Okay, Gandravastadi Kashayam with Rajanyadi Churnam or Dadimastaka Churnam.
wonderful, wonderful.
And depending upon the condition.
Yeah, we have given disclaimer, so no problem. I've told the viewers that you have to take a doctor's prescription. That's right. Just ask.
This in my private practice, I have seen this Gandhavastadi Kashayam has done wonders.
Wonderful.
Before starting the main treatment, I give this Gandhavastadi in the initial phase.
Even in ADHD,
Yes,
ASD
yes,
conditions.
yes.
Ah, wonderful, wonderful. So, other than this, when you said about deficiencies, in between we were talking about vitamin A and all that. Can you talk a little bit about the micronutrients which are involved in these children's development, like vitamin D,
Yes.
iron, calcium, phosphorus, magnesium,
For children,
zinc?
Children are more prone for, like nowadays, anemia is prevalent.
Yeah,
Okay, especially this iron deficiency anemia.
yeah.
Okay, iron deficiency anemia is more prevalent in Indian conditions and children and also in women. We call it as a nutritional anemia. Okay, the reason might be like too much consumption of milk. Milk will stop or will reduce the iron absorption. Okay, majority of the parents, moms, what they do is, if you don't eat food, at least have glass of milk.
There are also some places where doctors say if you take calcium supplements, you have to keep your iron supplement at a different time, right?
Different time.
It hinders with your. Sorry, I was just cutting in. Yeah, please.
So, milk consumption is very, very important. Like, it will alter your iron supplement. Okay, and iron supplement or iron absorption will be more when you are clubbing it with vitamin C. Okay,
Yes.
vitamin C fruits, oranges, nellika, or anything. Okay, so this has to be taken.
In Ayurveda, most of the times we give iron as iron citrate, right? We do bhavanam in this
amla.
dadima, this thing, or in amla rasa, that is with it is a sour taste medicine. We do the bhavana of the medication, right? Potensification of the medication. Yes, yes.
So
Please continue.
that is one. This one. And zinc deficiency, again, zinc is prevalently available in this karvepalai. Okay, but
the first thing we keep out is karvepalai.
Okay, so karvepalai is very good, which contains good amount of zinc, which is
Karvepalai is curry leaves.
Yeah,
I want
curry
everybody
leaves.
to. Yeah.
Okay, so that improves your gut health, that improves your digestion, that improves your absorption, that improves your premature graying. In children,
I need some.
in children, they have premature graying.
Yeah, yeah.
School-going children, they have
Yes.
premature graying. What they do is, when I talk about this graying hair, I remember one thing. Like parents will say that I'm using shikakai, okay, but hair fall is more. Okay, shikakai can be used only after oil application.
Exactly.
They don't use oil application in the dry hair. They use shikakai.
Yeah.
The same thing happens for sambrani also.
Hmm.
The newborn babies or babies, of course, many doctors they advise not to expose the baby to sambrani, but you have to do proper oleation or oil application for the baby, make the baby stay in the oil for some time, and then only we have to go for all these things. But the pre-operative things they don't do, and the main operative thing they do, and they will have all these complications.
I know. Shortcuts are sometimes not good. Yeah.
Okay, so this one, okay, zinc and vitamin D. Okay, vitamin D, if you see, around 6 to 7 people, even adults, have vitamin D deficiency.
Out of 10.
Out of 10.
Hmm.
Okay, vitamin D deficiency should not be there in temperate countries like India, Pakistan. But of late, we are facing vitamin D deficiency. The reason is it's not about the source of vitamin D; it is about the absorption.
Hmm.
Okay, we need to give medicines for improving the absorption of vitamin D.
Exactly.
Okay, so the
And
source,
no lack of exercise also.
yes,
Not
lack
many
of-
people go for regular
lack,
walks.
lack of
exercise.
exercise, and they are not exposed to sunlight. Okay, they
yeah.
are in the ACs throughout, and the latest in the previous it was said that the morning sunlight exposure to morning sunlight is good for vitamin D. But right now the research says that afternoon between the 2 to 3,
Wow.
okay, 1 to 3,
Scorching
okay,
sun.
for a half an hour exposure
Okay.
is must for vitamin D. How
Oh.
many of us are getting exposed?
I know.
Okay,
I know.
so all these things.
That is the time when we sit in
Yes,
AC.
yes. Okay, so all these things are for reasons for vitamin D deficiency.
Calcium, phosphorus, magnesium.
Again, calcium. These are all again. Everything comes with the diet,
Hmm.
a proper diet. Okay, calcium, paneer should be given.
Hmm.
Okay, and again, paneer, the available paneer in the market is not a routine one.
So for our viewers, paneer is a cottage cheese.
Cheese.
Cottage
Okay.
cheese.
Good quality, genuine cottage cheese.
You can prepare at home.
Yes, definitely. Okay, that can be good source of protein and calcium.
Hmm.
Okay, so and this chia seeds, what I've said. Okay, that contains good amount of what is it? Chia seeds or flax seeds.
Flax seeds. Yeah.
Flax seeds. Flax seeds contain good amount of protein and also calcium.
Very good. Very good.
Okay, dry roast it and take it. Okay, and this small amounts of palm oil,
Hmm.
good contains good amount of vitamin E.
This is the second time you're mentioning palm oil. I'm intrigued by that. Why palm oil?
Because it's a misconception that palm oil should not be. It's like an thoda.
Yeah, it is a taboo for many. Yeah.
But palm oil in small quantities, once in a while, is good for vitamin E.
Oh, okay.
Vegetable oils.
Okay. Vitamin D also helps in eyesight, right?
Yes,
Good.
yes.
Yeah.
Okay. So, but again, everything should be needed in a ration.
Rationed way. Yeah.
Okay, all the things should be needed in a ration. Even negative things should also be needed in a ration way.
That's right. That's right. Yes, sir. Dr. Uday, we talked about many things today. We talked about how Ayurveda can help in diet, through diet, and in ADHD, autism, immunity-related problems, respiratory-related problems. Is there any other general advice that you want to give to parents and children alike? Anything you want to talk about? Why should they approach Ayurveda? Just as a closure.
Okay, Ayurveda is not a science of what to say. It's not a medicine alone. It's a science of life. Okay, you embrace Ayurveda as your daily routine. Okay, simple oil application is Ayurveda. Waking up in the morning early is Ayurveda. Okay, and sleeping in time is an Ayurveda. Okay, doing yoga is Ayurveda. So this is Ayurveda is just nothing but it's a way of life. Of course, you need not go back to the centuries old way of living.
Yes.
The same what to say
Practices can be adapted to
the
today's
present.
life. Yeah, yeah.
This one, and you can this one. Okay. One topic which dental health in children. I forgot that one. Okay.
Many parents use
the
toothpastes which have harmful
Junior.
chemicals in it,
Okay.
which are also called as junior.
Okay. But again, they use the full toothbrush. I mean, like the complete bristles.
Yeah.
That is wrong.
1 or 2 inches of toothpaste.
Yeah. There are specific toothpaste available for kids, which I prescribe for my patients. Okay. And the size of the toothpaste should be only peanut size.
How much they use should be only a peanut size.
Even for adults, it should be of peanut size.
Hmm.
There is one reason for more presence of dental. It is not the chocolates which is causing dental caries. It is the high amount of toothpaste. And for them, the children who are having this dental caries,
Is it because of the fluoride? Or?
yes,
Huh.
okay. What I advise is give medicine, give foods which are able to chew. Give medicines which are don't give drinkables.
Hmm.
Chewables give paneer, give carrot. Nowadays, chewing has become a rare.
Yeah, it's very
More of a swallow, I mean, like a drinkables.
Hmm.
So chewing, what it does is it will make the gums loosen, and it will make the teeth, that is primary teeth, pulp teeth, milk teeth, it fall in time.
Hmm.
Now, if they don't chew, automatically the primary teeth it will be stuck,
Hmm.
and it will the secondary teeth, the permanent teeth, it will not come up. Okay, so this advice this advice I
Very
forgot.
valuable advice. Very valuable advice.
So I just want to add up.
Wonderful, doctor. Wonderful, doctor. We touched upon many topics today. Today was a very, very eye-opening session for not only my viewers, our viewers, but also to me in many cases. So we thank you wholeheartedly from Live Right Ayurveda Clinic, Gindi. We are very happy that you are also joining us
Yes.
on Saturdays for your consultation. Thank you, Dr. Uday.
Thank you.
Thank you so
Thank you.
much for being with us.
Thank you.
Thank you.